I am McKinneyPavlik. I have with me Jennifer Facinda, who is playing Dr. Lesnet, an ear, nose, and throat specialist in Northeast Florida. Dr. Lesnet is an ENT specialist who has been practicing ENT surgeries and examinations for about 6 years. She owns and operates her own clinic in Jacksonville, Florida, that sees approximately 30 patients a day. The 30 patients are divided among 3 different physicians, and there's also a registered nurse and 2 medical assistants to help run the facility. So each doctor is seeing 5 post-op patients per day and 5 examinations or pre-op patients per day. Dr. Lesnet is in her 30s. She doesn't fancy very much small talk because she's a very busy person running her own clinic. She doesn't have a whole lot of time. She is married, no children, and I'm not going to try to hit any of her hot buttons by running the meeting on too long or having too much small talk. My sales strategies will be the trial use. I will also give a demonstration, and my closing strategy will be that I forgot something. Hi, Dr. Lesnet. Thanks for meeting with me.
Absolutely. Glad I could.
I know you had kind of a sour experience with Medtronic or our equipment before, so I know that maybe there was some hesitation meeting with us. So I just really want you to know that I appreciate you coming out here. Can you tell me a little bit about what happened with your equipment during your residency?
Sure, yes. With my residency under Dr. Jones, we were using a piece of equipment, a Medtronic equipment, and we were in the middle of a procedure, and the patient was awake. They were not sedated, they were awake, and the equipment just failed. It would not operate properly. So at first we thought, okay, it must be operator error. We went through the manual on troubleshooting, then called our sales rep for some guidance, and it was like he just didn't have time for us. And that was just very frustrating. Of course, it upset the doctor, as you can imagine. In front of the patient, we spent hours trying to get it resolved, and it just the equipment completely failed. It wasn't user error at all, and just trying to get the equipment repaired was a nightmare.
Okay, well, I can definitely understand the frustration with that. I was in the ophthalmology field before. I was an ophthalmic technician, and I worked closely alongside doctors in the office and in surgical procedures. So I can definitely appreciate the embarrassment or maybe the lack of trust that would come from a patient when equipment fails in front of them, because I have had it happen, and it can really affect that relationship. So I actually just came back from Atlanta, and I know you did too.
Mm-hmm.
But our meeting there, it was for Medtronic, obviously, but we did a total revamp on the way in which we handle any issues with equipment. We also have a new facility up here in Jacksonville. I think maybe part of the issue that you were struggling with in your residency was that our facility was so far away. Well, now we're just down the road. So anyway, back to Atlanta. While we were up there, we discussed the new policy changes and the new equipment updates that I want to share with you. Mm-hmm. So our new equipment is the Stealth Station and the Compact Fusion, and both of these machines do what your equipment now traditionally does. It just does it with so much more detail that it's unbelievable. This equipment actually it's the same thing. The Compact Fusion is transportable, so if you have an immobile patient, you can go and see them there. But for in-office, you would use Stealth Station. Either way, the same concept is used on both of these, where a Bluetooth tiny little device is sent into the nasal cavity, and the patient's nasal cavity is totally mapped out in 3D images. So if you look at these pages, you can compare and contrast. These are the old images that would come from a device like yours, which is totally usable. There's nothing wrong with it. that's fine. You can still do your surgeries and do your examinations and decide what you need to do for your patient. But when you look at this one and you see the 3D imaging and the different color schematics and stuff like that, it gives you a really in-depth look of that specific patient. You know all the nooks, you know all the crannies, and the patient is seeing that too. So there's, you know, they're seeing this really updated piece of equipment at their doctor's office, and it just gives them a lot of reassurance. So that's a really big benefit to it. What I would like to do with you, though, because of your prior experience, I'd like to do a 30-day trial and see how you like it, and maybe do a closing today. How does that sound?
Well, I mean, the trial sounds great, but I am not ready to close on a sale. I mean, but I would be interested in trying out the product.
Okay. What is one of your main concerns with closing today?
You know, past history, of course. Not quite sure if I'm ready to make that commitment, but also, you know, price.
Okay.
Price is definitely a big concern. I know, I mean, Medtronic, I like what I see here. I mean, the images look great, but, you know, this is quite an investment.
It is. That's a huge investment. What we're finding with this equipment is that because it's so accurate, it's up to 1 millimeter accurate within the human head. We're finding that patients need less follow-up care, and they need less ointment to get them through the post-op treatment. So because they're coming into your office for less follow-up care, you're seeing them less, they're healing faster, it's a win-win for everybody. And because they're not coming into your office as frequently after a surgery, you're then free to book your schedule with pre-op patients, examinations, and different things instead of seeing the same person over and over, unless of course they need to come in for something special. But we are finding that each patient comes in on average less 2 visits than with the other older equipment. So
wow, that is definitely something to think about.
yeah. Oh, and you know what? I also forgot something else. Because we are at the end of the fiscal year, we have a special going on right now where you order either one or both of the machines if you like. You get standard hand tools with it, and with those hand tools you get free disposables for life. So, well, for as long as the machine is alive. So any hand tool that you add on with it also gets free disposables.
Wow.
And that's if you order in the next 72 hours, because we're at the end of the fiscal year. But
Okay. Well, that definitely makes it very appealing. You know, I like you so much, and this has been very informative, and I have a lot more confidence in you. So I think, yes, I'd be willing to give Medtronic a try.
okay, great. Well, here is my business card. I'm gonna send you the emails and all the right information to get this sale started. And that's also my contact information should you have any issues. And I just want to reassure you and tell you that if you call us with any issues, a technician is coming your way, whether you say, oh, don't send him or not. We are going to help you out. So
Okay.
I'm excited to do business with you. Thank you so much.
Absolutely. Thank you. All right.